Welcome to Organic Awakening. Imagine a world where heart attacks are a thing of the past, where you, your loved ones, and even your friends can be heart attack proof. That's not a fantasy. It's the powerful reality that Dr. Caldwell Esselstyn Jr., a 91-year-old pioneer in plant-based nutrition, has been advocating for decades. His groundbreaking insights, inspired by civilizations like the Okinawans and the Tarahumara Indians, reveal a simple yet life-changing truth. What we eat determines our health destiny. In today's video, we'll dive into his revolutionary teachings and uncover 6 powerhouse vegetables that can safeguard your heart and enhance endothelial health. But before we get to the list, let's first explore the vital role of endothelial cells in preventing chronic diseases like heart disease and even cancer. Stay with us, because what you're about to discover could be the key to a longer, healthier life. But first, let's understand the critical role of endothelial cells in preventing chronic diseases like cancer and heart disease. The endothelium, essential for heart and artery health. The innermost lining of our blood vessels has a name. It's called the endothelium. Each individual cell is an endothelial cell, and this is probably the most important group of molecules we'll discuss today. When you eat a cheeseburger, a milkshake, or pizza, the first thing that happens in your bloodstream is that those cellular elements begin to get sticky. Your endothelial cells get sticky, your platelets and clotting factors get sticky, your white blood cells get sticky, and your LDL cholesterol gets sticky. Endothelial injury leads to numerous health problems, including sleep apnea, periodontitis, metabolic syndrome, osteoporosis, erectile dysfunction, cerebrovascular disease, dementia, coronary heart disease, heart failure, and even sudden death. Endothelial cells produce nitric oxide, a vital molecule for maintaining vascular health. Nitric oxide is synthesized by endothelial nitric oxide synthase, ENOS, an enzyme in endothelial cells that converts L-arginine, an amino acid, into nitric oxide. The 4 crucial functions of nitric oxide prevent stickiness. Nitric oxide keeps all cellular elements within our bloodstream flowing smoothly, like Teflon rather than Velcro. Dilates blood vessels. It is the strongest blood vessel dilator in the body. When you climb stairs, the arteries to your heart and legs widen. This is nitric oxide at work. Prevents inflammation and stiffness. It protects the artery walls from becoming thickened, stiff, or inflamed, reducing the risk of hypertension. Prevents plaque formation. A safe and normal amount of nitric oxide prevents blockages and plaque buildup in arteries. All 4 functions are optimized when you follow a whole food, plant-based diet. The top 4 foods for a healthy heart doctor. Esselstyn's recommended diet includes whole grains, bread, pasta, rolls, bagels, legumes, lentils, and beans, colorful vegetables, red, yellow, green leafy vegetables, starchy vegetables and fruits, white potatoes, sweet potatoes, and various fruits. Among these, Dr. Esselstyn places special emphasis on green leafy vegetables, and for good reason. Why green leafy vegetables are essential. The production of nitric oxide by endothelial cells decreases with age. By the time you're 50, even if you're in excellent health, your endothelial cells produce only 50% of the nitric oxide they did at 25. By age 80, you've lost 70% of nitric oxide production from endothelial cells. Since heart disease patients are already deprived of nitric oxide, increasing intake of 6 servings of green leafy vegetables daily is crucial. The best way to eat vegetables for maximum benefits. We need antioxidants, but not from supplements. Avoid buying antioxidant pills from health stores. They don't work and can even be harmful. Instead, get your antioxidants from food, especially those high in oxygen radical absorbance capacity, ORAC values, like raspberries, blueberries, strawberries, blackberries. However, nothing beats the antioxidant power of green leafy vegetables. Dr. Esselstyn recommends chewing a portion of green leafy vegetables 6 times a day, roughly half the size of your fist. The vegetables should be first boiled or steamed for about 6 minutes until tender. Then anoint them with several drops of rice or balsamic vinegar. Why vinegar? The acetic acid in vinegar helps restore nitric oxide synthase, ENOS, the enzyme responsible for nitric oxide production in endothelial cells. The best times to eat green leafy vegetables. Dr. Esselstyn suggests eating them alongside breakfast, having them as a mid-morning snack, including them in lunch, eating them as a mid-afternoon snack, incorporating them in dinner, enjoying them as an evening snack, such as arugula or kale. The 3 key benefits of green leafy vegetables restores endothelial function. Green leafy vegetables help your endothelial cells maintain their ability to produce nitric oxide. Boosts bone marrow function. Chewing greens restores the bone marrow's ability to produce endothelial progenitor cells, which replace damaged endothelial cells. Provides an alternative pathway for nitric oxide production. Since endothelial cells lose efficiency with age, green leafy vegetables provide nitrate. When you chew them, the nitrate mixes with anaerobic bacteria in your mouth, converting into nitrite, which further transforms into nitric oxide in the stomach. This alternative nitric oxide production pathway is critical for heart health, artery function, and overall vascular well-being.